We thank Gibson Area Hospital and Health Services for sponsoring our segment this afternoon. As we age and experience certain life changes, our mental health can be impacted. If you are suffering from grief, depression, or anxiety, there is hope. Here now from the Gibson Area Hospital and Health Services, our registered nurse, Amanda Justice, and clinical counselor, Kara Niebuhr. Welcome.
Hello. Thank you.
Absolutely. Excited to hear more about this program. It's aimed towards older adults, and it is your mental health program over at Gibson Area Hospital. Right. Tell us about what it is.
So we are a group therapy program for older adults, generally 65 and older. We meet several times a week and last for several weeks.
All right. And what does this program entail? You say it's kind of a group program, and what does the process look like? You show up and kind of join a cohort, or how does that work?
In a way, yes. So our patients arrive in the morning around 9 a.m. And they are with us till about 1 p.m. each day of treatment. We have in that time 3 group sessions and then a nursing group session and lunch provided by the hospital. Our primary mode of treatment is group therapy, which can be very intimidating for a lot of people, but we find that it's very beneficial, especially for older adults. In addition to group therapy, we do offer individual therapy as well. And psychiatry. Psychiatry is a big component of our program.
Now let's just clarify the difference between, psychiatry and group therapy, because I know that, sometimes mental health all gets put into one basket, but there's really a wide range when it comes to people's needs.
Absolutely. A psychiatrist is a doctor who can prescribe medication, and their focus is mental health and psychotropic medication. As a therapist, my focus is on therapy and counseling. So our doctor, our psychiatrist, he does the psychiatry component, but I am focused on the counseling.
Got it. Now, you guys have a 95% patient satisfaction rate. That's pretty significant.
It is, yeah.
Now, if people are interested in coming, how does that work for payment? Do you guys take Medicare or insurance, or is it a pay out of pocket kind of scenario?
No, we take most insurances. We are primarily a Medicare covered program. However, we also take all of the Advantage plans, replacement plans. We always check insurance prior to enrollment so we can let patients know if there is an out-of-pocket cost.
Right, get that all set up front.
Right.
Now, do they need a referral from their doctor, or can they just call and set up an appointment?
They can just call and set up an appointment. Oftentimes our referrals do come from providers, but people can hear about our program and give us a call as well.
Awesome. Now here's a question. I wonder, what are the most common challenges when it comes to mental health? What are the kind of things that people are struggling with, especially later in life?
Later in life, obviously depression and anxiety are an issue across the lifespan, but with older adults we find that grief, isolation, and loneliness are, and adjusting to the aging process, those are the biggest issues that our patients come in with that they really want to talk about.
And sometimes we can discount those things as insignificant, but really quality of life could be really poor if those things are not taken care of. So I'm assuming these, your 95% approval rating from your customers or your patients is coming from their quality of life must be getting better as they go through this process.
Absolutely. We just had a patient today who said, well, I feel like everyone my age deals with this. And we say, yeah, it's normal, but that doesn't mean it's easy.
Right. Normal and easy, two different things. Well, you guys are doing important work. Thanks so much for coming in today to tell us about the program. To learn more about the mental health program available at Gibson Area Hospital and Health Services, who we thank for sponsoring our segment today, we'll connect you at ciLiving.tv.